how often should you be getting those numbers checked?
So there are different organizations that have different guidelines. Interestingly, now we actually recommend getting kids checked.
Really?
Because there are genetic disorders, and we can recognize it really in an early age. If you think about atherosclerotic risk, it accumulates over your lifetime. So the earlier you recognize it and correct it, the better it is. Most adults should get a lipid profile done as part of their physical, probably every 3 years if you're healthy.
Okay.
When you start getting older, maybe a little more frequently. If you have disease, it's something we follow because obviously it's a marker, or are we controlling the disease? But I don't think it's something that people have to run out and get right away or do annually, even though it's mostly done when you get your usual physicals.
So 3 years, but if you're at a higher risk, should you be doing it more frequently?
Sure. If you have a strong family history of premature vascular disease, you have additional risk factors, and that's something you want to intervene on, your lipid profile, you would want to get it more frequently. But from a process of checking it out, you do not need it more than every year, if that much. If you have an intervention done, you put on a medication, you change your diet, and you want to compare, that's a different story, but there's no reason to check it every couple of months without any intervention.
So where can people go to get more information on getting their cholesterol checked?
You know, I think that the National Lipid Association is really a wonderful organization, lipid.org, and they've got great education materials. I think they're leading the way in this space, leading some of the other big national organizations that deal with cardiovascular health, and I think they're a great site. There are lots of other organizations that promote, again, American College Cardiology has a whole lipid section and whatnot. But I really think the National Lipid Association would be a real good go-to site.
So National Lipid Association. Now, before we wrap, the exams that you take, these are just blood work, or? So
depending on how high one's risk is by family history and by other lifestyles, you usually start with a blood test. But not everyone with a high cholesterol and high triglyceride is going to have a vascular disease. That's why we want to individualize the patient. If you tell me your cholesterol is high and your parents' cholesterol is high and your grandparents' cholesterol is high and your great-grandparents who are dancing at the age of 105's cholesterol is high, I'm going to say maybe you don't have as big a problem. So there can be additional tests we might look for. In the right population, a coronary calcium score is a test for an individual, gives further screening. If you have other risk factors, for example, two people with the same cholesterol, one's a heavy smoker, we might say in that person we're going to lower your cholesterol more. We just want to impact whatever we can easily impact to lower inflammation. So like I said, the doctor's evaluation may include more testing to further stratify how high is your risk and do you need treatment.